Hello, I'm Adam Bress, Associate Professor of Population Health Sciences at the University of Utah School of Medicine and Chair of the upcoming AHA Scientific Statement on the Management of Elevated Blood Pressure in the Acute Care Setting.
And I'm Tara Chang, Professor of Medicine at Stanford University and co-chair of the upcoming statement. Earlier you touched on observational studies that showed potential harm with treating asymptomatic inpatient elevated blood pressure. Can you talk a little bit more about that now?
One of the best observational studies was a recent target trial emulation study led by Tim Anderson, who also helped write the current statement, and he looked at 66,000 older hospitalized patients for non-cardiac reasons who had 2 or more elevated blood pressure readings in the first 48 hours of their hospitalization. And what they found was that patients that received early intensive blood pressure treatment during the first 48 hours, defined as receiving intravenous or new oral antihypertensive medications that they weren't taking prior to the admission, patients receiving intensive treatment were 28% more likely to experience adverse outcomes, such as death, acute kidney injury, myocardial injury, stroke, or being transferred to the ICU. And those that were treated with IV antihypertensive had even a greater risk of these adverse outcomes compared to standard treatment. And these results were consistent across a range of subgroups by age, baseline frailty status, pre-admission blood pressure readings, early hospital blood pressure readings, and with and without a history of cardiovascular disease.
And to add to that, a study led by Dr. Lama Ghazi, who also was a member of the statement's work group, looked retrospectively at 20,000 hospitalized adults who developed asymptomatic, markedly elevated blood pressure. Those treated with IV antihypertensives had a 60% greater risk of myocardial injury.
Those data are quite concerning, and it really does illustrate the potential risks of using IV antihypertensive medications without careful consideration.
While most patients may not require treatment for asymptomatic elevated inpatient blood pressure, there are circumstances where the benefit may outweigh the risks. For example, patients with persistently high blood pressure readings, specifically those over 180 to 110 over 120, might benefit from initiating or intensifying antihypertensive medications during the hospital stay. Treatment may also be reasonable for patients with persistently uncontrolled blood pressure in the outpatient setting, specifically those at high risk for or with a history of cardiovascular disease. However, it's important to remember that blood pressure may take several days to weeks to adjust to a medication change. Therefore, a typical inpatient stay may not be sufficient to fully assess the effects of a medication change, and close outpatient follow-up is going to be essential.
I would also add that the reason for the hospitalization could also impact treatment decisions. For example, patients with resistant hypertension. A hospital stay for a cardiac reason might be a really good time for a more comprehensive workup for secondary causes of hypertension. However, if the hospitalization is for a condition unrelated to hypertension or cardiovascular disease, such as a pneumonia, it might not be the best time to intervene, as the focus for that admission is probably best to address the acute process or illness. Because their physiology might not be at baseline, it could alter their blood pressure readings in the hospital and also their response to blood pressure treatment.